Okay. Oh, I already have a chat message. Okay, sounds good. All right, well, welcome to week 2. I'm sure that week 1 was extremely busy for everybody, getting acclimated to all your new classes and trying to navigate through all your canvases and your new classes. So let's talk about last week. I know we covered the orientation PowerPoint and then week 1 notes. Okay, so does anybody have any questions from week 1, from either the material we covered or the orientation PowerPoint? Or any questions about this week and things due? Are you navigating through your shell okay?
Yeah. I just the community oriented and community based. The base is the individuals, correct?
You're working in the community with illness. It's focused on illness care, right? You're based in the community working with those clients. Where community oriented is you're looking at the big picture. You're looking at the whole population, right?
Okay.
Make sense?
Yes.
I want to give you an update on the books. The fundamentals book is the correct book that you have. The Elsevier lists it as Williams, the author, and our Canvas, our module lists it as DeWitt. They're both the authors. Okay, so we have the same fundamentals book. The fundamentals book is correct. The Med Surg book is correct in that I am still trying to sort out what a conversion guide is. We need to be able to convert edition 4 to edition 5, but you have the correct book for Med Surg. Okay.
Okay, I spoke to the dean and she made me purchase another book because she said that edition 5 is the correct one and then I have to get edition 5.
Okay. Well, hang on to that thought, because I don't think that's necessarily true. I'm trying to sort that out. I still don't have the answer yet. All right, but I'm told that the edition 4 that you have is fine. I just need to sort out what the conversion is of how we look at edition 4 with edition 5, how to find the information in the current edition you have from edition 5. It didn't change that much. Okay, so
yeah, that's what I heard too, that it's the same information.
Yeah. Just different page numbers.
Yeah.
Exactly. Walter, what campus are you from?
Cutler Bay.
Okay. Well, just hold on to that. I don't think that's what you needed to do, but like I said, I'm working on that. And then your Intro to Maternity and Peds is the correct book. We had never had an issue with that book.
I mean, it's not gonna hurt, so I have them both, whatever happens.
Well, hopefully you'll be able to return your edition 5.
I don't know, whatever, it's okay.
Okay. So that's the update with the books. Just a reminder, this is week 2. And so we have one more discussion post, and that's due this week, right? We'll go through, I'm going to share my screen now. We'll go through the module just to make sure that you guys. Okay, we did week 2. I just want to make sure that this is the second of 2 discussions, right? And that the initial post is due on Wednesday. Okay, there were a few people that didn't realize that it was due on Wednesday. And anyway, I emailed them Thursday morning, like I said I would, and they had to turn in Thursday, but just the reminder that it's due on Wednesday night. Okay, and then your 2 posts are due by Sunday. I haven't had a chance, but I'm going to work on it this afternoon. I'm going to do the groups. Okay, I'll be sending you out the groups this afternoon. Okay, that you'll use for your, I think, week 4 case study, right? Case study, healthy people right here. Okay, in week 4. So I'll send out the groups today. All right. What else are my updates? And then today, after we have class today, at some point this week, make sure you do quiz 1. Okay, which is based on the information we're covering today. Okay, and that is a key graded assignment. So make sure you do that. And then we'll do our live attestation at the end of class, so that that gets done and you don't need to worry about it. Okay. Any questions? So today we're going to cover, while you're reading today, has anybody done the readings? In the PEDS book, this should all be correct. Okay, in your fundamentals, you have chapters 11 and 12. Okay, and in the med surge, you just have 1 page. Okay. So these are the things we're going to cover today. Okay, we're going to cover some asthma, eczema, type 1 diabetes, conjunctivitis, scabies, pediculosis, ADHD, iron deficiency, anemia, scoliosis. And these are all the pages that information is found on. Okay, and then chapter 11 is growth and development, infancy through adolescence, and chapter 12, adulthood and the family. Okay, and then your 1 page in community, which is community care. Okay, and we'll start off by covering school nurse and lead exposure now with our concept sheets that are built right into your module, and then we'll go over to the notes. And I sent you all week 2 notes last evening. Everybody get that? Okay. So, any questions before we get started?
I have a question really quick.
Yeah.
The Elsevier you were talking about, that's just online, right? We go to like our student resources and
Yep.
find that.
Yep.
Okay, I just wanted to make sure.
Yep. Yep. So let's start with the school nurse, which is my most recent experience of the last 20 years being a school nurse. What do we think school nurses do? Well, let me rephrase that. When I started in nursing 40 years ago, what school nurses basically gave great big hugs, put on some Band-Aids, and maybe gave an ice pack. Right? What is school nurse? Has anybody been involved in school nursing?
I don't know. It seems like now when I was in high school, we didn't really have a school nurse. It seems like some schools don't have a school nurse anymore.
Okay. Well, there's different models of school nursing. For example, like I know in the state of Massachusetts, where I'm from, they have an RN in every school. And sometimes they cover 2 schools. But in the job I just retired from in Denver, our big school district, we were called nurse consultants. We covered numerous schools, which means we had health aides or health techs or whatever you want to call it in every school. Okay, and they were there from bell to bell, and they could be an LPN, they could be a CNA, they could be a parent, they could be, there wasn't a lot of experience required, and we trained them. We trained them to do lots of different things, give medication, take care of diabetic patients. We delegated a lot. So somebody was probably in your school, but it may not have been a nurse. But there was always, I know, for example, in the Denver area, like in the religious schools, the Catholic schools, the front office secretary handles all the things that come to the clinic. So it's different. Every district is different. So what do we think school nursing looks like now?
They verify immunization.
Yeah,
for the grades.
yeah. Yeah, keeping track of immunizations, sure. What else? Let's assume you're a school nurse in the building. You're going to obviously be taking care of the clinic and anything that comes in, right? You're going to be, so these days, at
Doing
least
a lot of education.
education. Yep. With my high schools, we did drug prevention programs. A lot of education. Preschool, we did good hand washing. Elementary school, we did good nutrition. We did exercise, healthy eating. In our middle schools, we did stay away from drugs, don't smoke. So that was the education piece. So yes, that is a big piece. And then the clinical piece was in the clinic, taking care of kids that come in, right? Whether they've had an accident or whether they need a Band-Aid, whether they need medication, for whatever reason. What else do we do?
Would they keep like informed like stuff going on with the school, with the health department as far as community, like if there's lice going around and
Absolutely. Absolutely. So they're also they're part of the really public health team that if you have guidelines of what has to be reported to the health department, that's part of your job. If a parent calls in and says, my kid was diagnosed with pertussis or chickenpox or whatever, strep, is that a reportable disease to the health department? It depends. You know, every state has different regulations. Pertussis was definitely reported. Okay.
With my son, he was in a Head Start, and their nurse, he used to go with her to do like work on his speech because he has like a little stutter.
Uh-huh. Okay. And typically they have a team that works in the schools, whether it's physical therapy, occupational therapy, speech therapy, that the kids are pulled out and go and receive those services. That's usually not part of the school nurse. I mean, the school nurse is, or the clinic, that's more of the health and wellness of the kids. The other thing,
Okay.
the other thing the school nurse does is screenings. Right? He or she does vision and hearing screenings. She might do height and weight screenings for concerned students that may be at risk of being at risk for being obese. She screens for lice.
Do they do any?
Administer? Go ahead.
Pardon
I'm
me.
sorry.
Go ahead.
Do they do anything for sex education and
Oh yeah.
safety?
Oh yeah. That was all at
All
the
that?
middle school, high school level. Lots of education programs on all of that. Yep. So you could be screening for lice, you could be screening for bed bugs, anything that the kids might bring to school. Allergies, being very, very aware of who's allergic to what, who needs an EpiPen at school, who doesn't need an EpiPen at school. The other thing that's big with school nursing is communication back and forth with the parent. You know, if a kid has a ski accident or has some kind of an accident, they come into school in a wheelchair or crutches. You know, how do you maintain the safety of that student? How do you make the accommodations for that student so they can be in the building? So safety is another big concern. And then, you know, our classrooms are all inclusive now. So school nurses I was extremely involved with the very vulnerable students with trachs, students that need to be cathed, students with diabetes that needed insulin injections or pump, you know, doses. Seizures is a big one. Lots of kids have seizures, so some of them have emergency, you know, midazolam in the clinic. You have to be able to know how to give that. So seizures is a big one. Mental health. is huge, you know, to be able to use your assessment tools to evaluate, you know, the kids that are struggling. Usually the school nurse is also part of the special education team, right? So you have your special ed case manager, you might have your social worker, psychologist, nurse, PT, OT, speech, administration. So you're also very much part of the special ed team. And part of a role of the school nurse to contribute to that special education team when kids are being evaluated for special ed or having their annual renewals for special ed, the school nurse is going to be responsible for doing a health inventory. You know, if it's an initial student going into special ed, you need to be able to do a full health history with the parent and understand what's going on. And then you have to be able to speak with the parent annually to find out if there's any updates. School nurses have a huge role. And then if you think about the last 2 years, school nurses have become COVID nurses, public health nurses. Okay. Kids, lots of kids have chronic conditions now. Asthma is really a big one. Okay. Some kids may just have exercise-induced asthma and don't need an inhaler, and but other kids have inhalers at school. Some of them have asthma that needs to be treated before they say go to PE or go out to recess. We call that pre-treating so they don't get into trouble. A lot of kids take daily asthma medication in the morning before they come to school. So hopefully it holds them over and we're just using the inhaler as a rescue inhaler. Same with allergies. Kids in school have EpiPens and kids in school don't have EpiPens. So the school nurse is responsible for not only communicating with the parents, but also to the staff. Right? Staff need to know which kids have EpiPens in the school, what their kids in their classroom are allergic to, so they can be mindful of, you know, kids bringing in lunches with peanuts or peanut butter, and you've got kids in the classroom with severe peanut allergies. So lots and lots and lots of stuff. Lots and lots of roles school nurses play. Okay, so school nursing is under the umbrella of the National Association of School Nurses and the American Academy of Pediatrics. Those are the two national organizations that we have our guidelines from. Okay, the national, if you want to look more about school nursing, the National Association of School Nurses, NASN, is an excellent, excellent website. It's A to Z on what school nursing is. And same with the American Academy of Pediatrics. We get a lot of our recommendations in general from American Academy of Pediatrics. Okay, and they do recommend there's a full-time nurse in every school building. That's just not possible right now. Okay, there's a lot of states and a lot of districts that try and do that. And that's what AAP suggests. But in our district, we covered numerous schools and had at least a health tech in the clinic all day long. Okay. So in 1902, the first school nurse reduced absenteeism by helping students and their families manage contagious diseases. Right. And that's the other thing now it's 2022, we're still involved with that. Okay, our role is to have the students in school. We don't want them to be absent for any reason. Cast, surgery, cancer, extremely disabled, requiring caths or G-tube feedings or trachs, or we want all those students to be in school. So we care for them in school. Okay, so in the United States, more than 40% of school-age children and adolescents have at least one chronic health condition, such as asthma, diabetes, seizures, food allergies, or just poor oral health. Okay, for these students, school nurses, who are often the only healthcare provider in the school, play a large role in the daily management of their conditions. School nurses or other school health services may also be the first to identify chronic health conditions in students through routine health exams. A lot of times when the students come to visit the clinic and the nurses in there doing their assessments will pick up on things that are going on that the parents may not be aware of. A lot of times we pick up on the seizures. A teacher will say, hey, can you come observe a student? I think something's not right. You go observe a student, and sure enough, absent seizures are in place or happening. Okay, we help the families in many, many ways. We help the families with identifying issues at school. We help the families with finding resources, right? Whether it's insurance or food banks or, services. Okay. And then research shows that some students with chronic health conditions may miss school more often than others. And as we know, there's a mandatory attendance policy. Students have to attend a certain amount of days per year. Okay, so our job is to keep them in school. Okay, the other thing we do is referrals to doctors. Now, a lot of our little kids in the elementary school that are having issues potty training, and I'm talking kindergarten, first, second, third grade. We're able to refer them on to clinics and doctors that will assist them in this process. And same with psych. We're able to refer them on to psychologists, psychiatrists, mental health centers. School nurses are kind of the glue for health issues and health promotion. School nurses kind of hold everything together. Okay, and obviously the more absent the student is, the more it affects absenteeism, right? And the more they're absent, the more it's going to affect their academic performance. Okay. Schools can help students with chronic health conditions by providing services through a school nurse or school-based healthcare centers. In our district, we had 3 high schools that had a school-based clinic or school-based health center in it that was staffed by nurse practitioners from the outside. And so these were free to low-cost visits that any family in the district could bring their kids to, so they didn't have to go to an urgent care if they didn't have a pediatrician or if they didn't have insurance. Okay, and those provided well child visits, immunizations, screenings, and they're starting to pop up all over these school-based healthcare centers. Okay, so the parents can drop off older kids at the high school or whatever and go in for an appointment for their younger ones. Okay, school nurse can help students and their families get access to health insurance. So when hopefully the school nurse at the beginning of the year is identifying which students, usually it's part of registration. Do you have health insurance or do you not? And if they don't, where can you refer them? Our district is large enough where we had a Medicaid office. Okay, so you were able to do referrals to Medicaid for families that didn't have insurance, and Medicaid would contact them to see if they could get them enrolled in, it's called CHP, at least in Colorado, in a low cost or free insurance program. Let's see, the benefit of school nurses reach way beyond school walls. Okay, I had ongoing relationships and dialogue and communication with parents all days of the week. You become kind of their trusted advocate for healthcare issues with their kids. School nurses not only make a big difference for student health and academic achievement, but they can also save money, right? Research shows that for every dollar spent on school nursing, society saves $2.20. These savings come from preventing costly emergency room visits and parents missing time at work to care for their sick children. So we try and stay on top of things. You know, we try and be proactive when we see these kids in the clinic. And if we notice something that's going on, we're able to pick up the phone and talk with the parent and get them in to either see their pediatrician or and try and avoid ER visits. School nurses are providing school health services for students both in person and remotely. Well, we've talked a lot about in person, but remotely. We all worked remotely for 2 years when the kids were out of school, right? And I was doing counseling and communication with parents during COVID, night and day. Okay, all of that 2 years, all of our communications with the parents was conducted virtually or by phone. Okay. Roles and responsibilities of the school nurses are expanding to deal with public health crises. We're always being trained for potential new pandemics, coming up with emergency plans of dealing with a epidemic of, say, pertussis in a school or chickenpox in a school. Okay, or a public health crisis in the community like COVID. Right, and this more applies to COVID here. School nurses are playing an important role in keeping schools open for in-person learning during COVID, while protecting the health and safety of students and staff. Right, providing school health services for students, we said that, in-person, remotely, evaluating students for COVID-19, educating staff, students, parents, and community partners with COVID-19 prevention strategies. Our superintendent, we have 90,000 kids. Our superintendent felt like they could open schools because the nurses were able to make that happen by, you know, following the policies and guidelines of the state health department with regards to COVID interventions. Okay, we were a very intimate part of the COVID pandemic. Okay, we also set up employee wellness programs. Okay, we work with our employee wellness department, and nurses are going into the high schools and doing all sorts of education, you know, transitioning from high school to college, very involved with that. And there's a couple of websites here: CDC School Health Services, CDC Managing Chronic Health Conditions in Schools, and then Family Engagement in School Health Services. So take a look at those links. And then the references from the above information we just covered are here. And this is an excellent link. It's a CDC talking about school nurses and keeping students healthy. I mean, that's the goal. Our goal is to keep students healthy and in school. Okay. I love being a school nurse. Loved it. You were really involved with the kids. You were really involved with the parents. You were also very involved with the staff. You had a hand in almost everything going on in the school, or at least a role or being part of the team of everything going on in school. Everybody would always ask for the nurses' input with anything going on. Any questions about school nursing? You have a better idea of what school nurses do? Okay, let's talk about lead exposure. This is in addition to your readings. Where might we find lead? Where's there lead still floating around?
Paint.
Mhm. What environments might we find lead in still?
Is it pencils or something?
Well, older homes, older schools, older rec centers. Right? One of the biggest risks to kids is exposure to lead. All right, the harmful effects of childhood lead exposure can be prevented. The key is to keep the children from coming in contact with lead. Okay, where do we find lead? It's in paint, soil, air, water. And lead, as we know, is invisible to the naked eye and has no smell. So if the kids are exposed to lead, it can cause serious harm. And again, this is right in your module. Okay, and what does serious harm mean? What are some examples? Damage to the brain and nervous system, slowed growth and development, learning and behavior problems, and hearing and speech problems. So there are many ways that parents can reduce the children's exposure to lead before they are harmed. Lead hazards in a child's environment must be identified and controlled or removed safely. Okay, and in the community book that we're not using anymore, but they had an excellent thread, an excellent box in one of the chapters that was lead exposure. And it was the primary, secondary, tertiary. So primary, give me an example of a primary intervention with regards to lead exposure. What would you do as a primary prevention? Remember, primary, we're trying to prevent. So what might you do? What might be a primary intervention on the topic of lead exposure?
How about sending information to the community
About
about lead poisoning and stuff like that?
maybe yes, exactly. How to prevent it. Okay. What would be a secondary intervention?
Testing for it.
Pardon me?
Making sure the water and stuff is tested before you
Mhm.
drink it, before they drink it.
Yep. Let's say you have a potential risk for lead exposure, right? So let's say in a community, you have a potential risk for lead exposure. So what are we going to do? We're going to screen, right? We're going to screen for, remember, secondary screening. You know, we find our at-risk groups and we screen them to see if they have been exposed to lead, right? Hopefully in the early stages. Remember, secondary screening, but it's also early identification, early intervention. So you find those at-risk groups. And then what's going to happen if you're at the tertiary level? What has already happened?
They already have the lead poisoning.
Yeah, they've already been exposed to lead. And maybe they're starting to, maybe they show up with nausea, vomiting, those kinds of things. Well, now you have to manage it. They've already been exposed. Now you have to manage the symptoms, right? And the goal is to get obviously their lead blood levels down in a normal range. Does that make sense? Common ways children can come in contact with lead, right? So young children can be indirectly exposed to lead when they put objects containing lead dust, toys, trinkets, or their fingers in their mouth as part of normal development, right? Kids may also be exposed through contact with paint chips and dust from lead paint. This could happen in buildings, homes, Dust may have landed on the windowsill. Right? They're touching it, it gets on their fingers are always in their mouth. The most common exposure is from swallowing house dust or soil contaminated by lead paint. Those are the most common sources of lead exposure. And obviously, if they swallow paint chips. So an example is old or worn lead paint peels and cracks. You know, if you ever go over to windowsills in an old house or an old school and you've got paint chips that are peeling, or you can just pull them off. That's what we're talking about here. Right? So worn lead paint peels and cracks, and tiny bits of lead dust settles in and around the homes. Doors, windowsills, wells. And this is a nice visual of how to prevent childhood lead poisoning. And we already went through the top 4 circles above. And with those, if any of these are going on, damage to the brain and nervous system, slowed growth and development, learning and behavior issues, and hearing and speech problems, though any of a combination of those 4 can additionally cause lower IQs, decreased ability to pay attention, and underperforming at school. Okay. So exposure to those 4 above, right? Brain and nervous, slow growth and development, learning and behavior problems, hearing and speech problems can be going on, or things that would be going on that might create this would be building destruction or remodeling, paint removal, and preparation of services for repainting. And I know we don't always think of lead exposure. I mean, we know it's risky, but it's a really big deal with kids, especially the young kids that put everything in their mouths. So lead paint or dust are not the only ways lead exposure can occur in kids. Some other sources include soil, dust from the soil.
Can I ask a question?
Sure.
Can a pregnant, like a mother, get transmit lead poisoning to an unborn baby?
I don't know. That's a
If
good
exposed?
question. I mean, I would think so, that it's transmitted transplacentally. I don't know the answer to that question. That's a good question. I will look it up and get back with you.
All right.
That's a good question. Drinking water, or let's go back to dust from the soil, right? If the soil is contaminated with lead from sorry, I was just letting a student in, from gasoline, aviation fuel, mining, industries. And that's why we talk about, that's why there's so many, you know, when you drive around communities and you see new developments, everything has to be tested for lead regarding the soil, right? Soil can be very contaminated. Okay, and then drinking water. What if drinking water is delivered through lead-based pipes, faucets, or plumbing fixtures? Right? Traditional medicines and cosmetics, such as Zarcon and Greta, which is used for an upset stomach or indigestion in the Hispanic communities. And then there are certain candy and candy wrappers, consumer products, toys, jewelry, antiques, collectibles. And then another source is lead glazed pottery. And then adults, You know, it's just not children. I mean, children are much more susceptible, but adults who encounter lead at work or from hobbies can expose their family by wearing these clothes home, wearing these clothes into their home and washing them with the family laundry. And certain hobby activities that can expose adults to lead, using an indoor firing range, doing home repairs, remodeling, making pottery, collecting or bringing scrap metal home, battery recycling, stained glass window fabrication. And then this is a nice link from the CDC with regards to preventing children's exposure to lead. And this is also good. I don't know if anybody's had a chance to open it yet, but it's a lead exposure. Where is it? Toolkit. So if you're working with kids or working with families, okay, here's a nice toolkit. There's actually a lead poisoning prevention week every year. What is it? Goes through what lead poisoning, National Lead Poisoning Prevention Week is. Trying to reduce the community and children's exposure. And we're all at risk for lead exposure. Okay. So this is an excellent, excellent toolkit. So if you want to read more about it, have a look at that toolkit. I'm not sure what you all do in your work lives, if anybody works with kids or works near schools or potentially works with people that might be a source of lead exposure. Okay, any questions about that? About lead exposure? And then I want to go through the notes. This covers, whoops. Well, actually, I want to go over, we're going through all of this now. School nurse, let's go through growth and development. We're going to go through some common childhood ailments, which are covered in your notes. What's family nursing and what are family health risks? Okay, and there's your discussion question. Okay, and remember for your discussion question this week, there's a list of common childhood ailments to pick from. You need to pick 3. Okay, you need to do a few things with all 3. Okay, you need to describe the signs and symptoms of each one. And you also have to do a 6-point education plan that you would share with the family and or teachers on each of them. So if you pick asthma, allergies, and diabetes, you have to list and describe signs and symptoms of each one and come up with a 6 points of education to share with families or teachers for each one. Okay. So our notes are a summary of all the readings. Okay, let's do a little bit more on school nursing from the notes, just to recap. All the roles the nurses may play, we've already discussed all this. Caregiver, educator, consultant, case manager. I didn't use the word case manager, but a case manager is somebody who coordinates care. Right, so I was the case manager for very complex, complex students with health issues at school. I would be the case manager, so I would communicate with the parent, the teacher, the health aide, the classroom teacher, the special ed team. We become case managers. We are involved with children with complex chronic illnesses, and we coordinate the care with other providers, speech, OT, right? That the student needs during the school day. How do we keep the students safe and involved in the school day? So we may be a case manager. And we talked about community outreach, lots of community outreach, participating in health fairs. I was always involved in vaccination clinics or vaccine days where, you know, on a Saturday would invite any family in the district that needed vaccines or immunizations to come to our clinic. So we're also very involved with the outside the school. Okay. And here's a nice little talking about primary, secondary, and tertiary in the schools. So what are some examples of primary, right? Primary is preventing a problem before it ever occurs, right? So providing education on childhood injuries, right? Seat belts, helmets, playground safety, prevention of sports-related injuries. In high school, we work with coaches, trainers. Okay, we also were involved with prevention of substance abuse. We talked a little bit about this. Education on the early effects of substance abuse. And then mental health was a big deal. Try to educate and train on, you know, developing appropriate coping mechanisms. And we did a lot of teaching. We did a lot of teaching, education with the teachers in the community on what might substance abuse look like, how might the kids be acting in class, what are the current trends, what are the dangers. Okay, and the third bullet is we were involved in trying to reduce the risk of disease. Number one, immunization requirements. Very involved in immunizations. Right? All states do allow medical exemptions from vaccines. And then most states, 47, allow exemptions for philosophical reasons, religious reasons. Okay, and we have to respect the decision of the parents. If a parent does not want to get their kid immunized for personal reasons, religious reasons, or the kid can't be immunized based on what the doctor says, we have to respect that. You know, there is a national law. It's no shots, no school. And that's for kids that don't have exemptions. Okay. And usually it's about a 10%, 10 or 11%. That's the national average of kids that are not immunized. Well, at least I had it in each building, but those parents had exemptions. Okay. We also did flu clinics. So we're in the bullet point of reducing risk of disease, flu and COVID prevention techniques, diet, exercise, lifestyle to reduce chronic illnesses. And then interestingly enough, Healthy People 2030, one of their objectives is to reduce the number of schools selling junk food. It's gotten a lot better. And then sex education. I think Walter, did you say that? Something about that?
Yeah.
Sex education and prevention of STDs, unintended pregnancy. That also comes from Healthy People 2030. And then this happens in the high school. If directly questioned by a student, you can discuss contraception, emergency contraception. right? Children and adolescents have reproductive rights and parental consent is not required in response to direct questions or requests. Everybody has personal feelings one way or the other, but currently that's how our system is set up. Right. And one of the most important things when you're working with kids is you always have to keep the child's developmental stage in mind. Right. The younger the child, the shorter the education should be. Pictures, for our littles, in the primary grades, pre-K through 2 or 3, pictures, toys, stuffed animals. Okay, so that's some prevention strategies. Now, secondary, screening for early identification and early treatment of a condition. So here's some examples. Headaches, stomach aches, we're still in school nursing. Headaches, stomach aches, fever, sore throat, cuts, bruises, sprains, anxiety, rashes, itching. Right? Children are likely to have somatic complaints related to psychological issues. Chronic or frequent headaches / stomach aches require investigation into bullying, anxiety, depression, sexual abuse, physical, emotional abuse. I use the example of, say you're the school nurse and little Susie comes in every day for the last 2 weeks at the same time. She comes in at 10:30 in the morning. And so the first couple of days, okay, you got a stomach ache again, lay down, whatever. And then by the 3rd day, I'm calling the parent and I'm saying, this is the 3rd day Susie's been in here at 10:30 in the morning. Is there anything going on at home I need to know about? Or is there a reason she's having stomach aches? Have you, pardon me, checked out by the doctor? Parent says, no, everything's fine. I don't know what's going on. Well, then as a school nurse, you have to put your investigative hat on. Where is she at 10:30 in the morning? She's coming at the exact same time every day. And this is actually a real life example that I had. Well, go back and she's in between 4th and 5th period, right? And she's just coming to the clinic. Talk to the teacher in the 4th period. What's going on? Well, she's sitting in the back with a group of girls and, they're not very nice to her, whatever. Okay, that's fine. So then she comes between 4th and 5th period. Well, she goes to 5th period and gets bullied by another group of girls. So she doesn't want to go to 5th period anymore. She'd rather come in the clinic and hang with the nurse because she doesn't want to deal with the bullying and abuse. Okay, we dealt with that quickly once we found out what was going on. But my point is, you have to be aware that after 2 weeks of coming to the clinic at the same time every day, something else is going on. And that's part of our role, to be mindful of that and to try and figure that out. Okay, so another example of secondary prevention is screening for potentially contagious illnesses. We talked about this: lice, conjunctivitis, chickenpox, flu, COVID. Screening for risk or presence of chronic illnesses, obesity. Okay, there is always going to be a group of kids that are at risk for obesity, right? We want to pull those kids in, and we want to start to talk about early intervention. You have risk factors. How can we prevent you from becoming obese? Here's the things you need to do in practice. Okay. And we're also screening for kids with asthma and allergies, anxiety, depression, ADHD, bipolar. And then the other thing we are doing for secondaries, we're screening for child abuse and neglect. And we all know we're mandatory reporters, correct? And what does that mean? What does that mean?
We have
We
a
have to
duty.
report things.
Go ahead, Walter.
We have a duty and obligation as a healthcare provider to report any suspicion of neglect or abuse.
And is that just in your work setting?
No, that's everywhere.
So it could be at the grocery store.
It could be in the store, it could be your neighbor, it could be
Mhm.
anyone. We have a duty, we have a responsibility.
Does everybody understand that? Because I've had students say to me, well, it's really none of my business and I don't want to get involved.
No.
That won't fly.
In our hospital, even if I'm not on duty in the hospital, I have it and I see anything. It doesn't matter your position or who you are required, you by obligation, you need to report it.
Mhm.
It doesn't matter
Okay.
who.
Vision hearing screenings is another example of secondary scoliosis screenings. Okay, and some more information about bullying. Identify bullying. Bullying will then identify some risks of potential mental health disorders. Okay, could you recognize a student that was suicidal? Could you pinpoint a student who is creating violence towards others? And bullying is important. Bullying is at the center of most school violence, whether it's at home or at school. Right? So if we're screening for these behaviors of bullying and intervening early, we can try and help reduce the violence toward self or others. Right? Children need mental health services early as possible when they're facing such adversity. Right? And what do those mental health services provide? Improve coping mechanisms, improve emotional and mental development, right? And to prevent long-term mental health. And what have we noticed with mental health over the last 2 years with regards to the pandemic? I really would like I would like other students to participate besides Walter. Please.
We have a lot of more mental health issues, homeless or households that don't have food. So different situations, economy wise.
Yeah. And then what happened with these kids during COVID when the schools were closed for 1.5 years? Isolation, social deprivation with friends, depression, poor school performance. And we're really, really starting to see the effects of that now. Would you guys agree with that?
Yeah.
And like physical education, I'd say as well.
Mm-hmm. Yeah.
I heard there was some talk of like students or kids that had trouble at home, then they were around that environment a lot more.
Exactly.
So it could have been detrimental in that way if they had like a troubled parenthood or such.
What if they were already a victim of child abuse? And now they're at home full time with that abuser.
Yep.
Right? Or what if the parents were in a domestic abuse situation and it really didn't happen in front of the kid because the kid was always at school? Or when it did happen, the kid was at school. Now they witnessed it at home. Lots and lots and lots of new mental health. I mean, I was talking to a nurse back in Denver, and she had a student, one of my old teammates, she had a little second grader that just went off the deep end, and there was a 6-month wait to get him any mental health treatment. Second grader. I mean, the mental health issues have exploded. We just don't have the facilities and the staff to take care of these kids. It's really sad what isolation did for these kids. Okay, and then let's go through a couple of tertiary. Okay, so tertiary would be medication administrating, administration, meaning that they have some kind of a condition, allergies, asthma, ADHD, seizures, that require them to take medication. So actually giving medication is a tertiary prevention. So they already have something that they need medication for. Right. And then another example of tertiary prevention is case management. Right. The kids are already classified as a special ed student. Okay, so we're participating in the IEP, which is the Individualized Education Plan, which is a federal regulation that every special ed student needs to have an IEP. Right? And that IEP includes what services does the student need, what accommodations need to be made for the student in the classroom, you know, for kids that have chronic illnesses or services they need. Right? And tertiary also includes teaching students, parents, teachers how to manage chronic illness such as asthma, diabetes, allergies. Children, interesting statistic, children are at higher and higher risk of type 2 diabetes than they ever have been, along with the risk of type 1. Why do you think that is?
Nutrition, like nutrition for type 2 kids.
Maybe obesity?
Their diet, everything.
Lack of exercise. Yep.
Especially because of COVID and everything that's going on. They probably, you know, aren't able to go to the park or go to social outings like we have been.
Right. And then you're always going to have in your school system working with pregnant adolescents. Our district was so large, we had a school that the pregnant teens went to. Had an OB nurse there, had prenatal checks there, so that we could care for our pregnant adolescents. Right? How could we still wanted our pregnant adolescents in school? One of the things we learned is that it was actually an exam question on one of our RN exams is, what's the priority for a pregnant adolescent? And they gave 4 answers. And the priority answer was keep them in school, because there is such a correlation with pregnant adolescents who actually finish school towards a healthy outcome for both mom and baby versus dropping out of school. Okay. Okay. Let's shift gears and talk about family development. What is a family? What's the definition of a family? Is there any traditional definitions anymore?
No, it's just basically what it says, like
whatever they say it is. Right? Family is the people who provide physical, emotional, and financial support. Non-traditional families are the norm now. Okay. So when we talk about what is a healthy, functioning family, okay, this is the difference between functional and dysfunctional. Okay, so these are some terminologies: healthy family, non-healthy family, functional, dysfunctional. So the next section is, what is a healthy, functional family? And there's 5 functions of a family. And they're right here: financial, health, reproductive, socialization, and affective. Okay, so you can read through each of these, but this is what, I mean, I know there's a lot more, but this is what is identified for this week's content. So for example, for financial, planning for the future, making good financial decisions, providing housing insurance, that's an indication of a healthy, functional family. Health, teaching healthy behaviors, teaching health maintenance, providing informal caregiving. So these are the 5 categories that are described of what makes up a healthy or unhealthy family. So I guess in the case of an unhealthy family under financial, right? No planning for the future, maybe is unemployed, maybe is homeless. Okay, so you just have to think in terms of the opposite for each of these 5. Okay, and as it states here, failure to meet these functions leads to dysfunction, strife, and crisis. A strong contributing factor to future substance abuse, anxiety, depression, work absenteeism, unsafe sexual practices is a dysfunctional family setting. Why is that? Because all these are risk factors, right? They're all risk factors. Any combination of any of these creates a risk of dysfunctional, creates a risk of a dysfunctional family, right? And family is our first and most important safety net and our most important social support system. Primary coping mechanism. Without it, without your family, the tendency toward maladaptive coping mechanisms rises. Would you agree with that? So in families, problems can be predicted via the family life cycle theory. Okay, so what this theory does, it evaluates the developmental stages of the children and the response by their parent. Right, so in development, failure to achieve a task restricts development towards the next stage. Right, so when we were doing our evaluations for our special ed students, we called them developmental milestones. When did they sit? When did they crawl? When did they walk? When did they talk? When did they jump rope? Okay. So kids develop in direct relation to parental response and the changes they undergo. So for example, a very uninvolved parent who didn't take kids in for well checks or get immunizations or provide adequate nutrition at home, those kinds of things, those kids are already behind the 8 ball. Right? With regards to behavior, growth and development. And then table 18.1, you can read through. It's traditional family life cycle stages and family development. Okay, so it starts with the married couple. Childbearing families with infants. Okay, so that's where it starts, the married couple. Then they have babies. Then they have preschool kids. Then children, then school age kids, and then adolescents. This is highlighted. You need to know these. Okay. So have a look at that. Family health risks. Right. So disease develops in response to 3 contributing factors. Either genetic, environment, or lifestyle behavior. Right? And when we're caring for families in the community, we have to consider all 3. Okay, what do they mean? Genetics. Genetics mean that we're all born with certain predispositions. But the majority of diseases are not caused directly and solely by genes. Most require environmental exposure and behaviors. Family history, health histories can help identify genetic risks. We call that a genogram. 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 Anybody know what a genogram is from your readings? A genogram it's genetics. So let's say somebody in the family dies of unknown causes. Okay. they're going to go back and do a genogram and go back maybe 3 generations of that family to find out who died from what. Okay, so it's like a genetic history. So for example, a couple of years ago, I had breast cancer. We don't have any breast cancer in my family. But I had to go back and do a genogram going back 3 generations to find out what my aunts and uncles and grandparents all died from. Nobody died from breast cancer. So that's what that genogram established, that this was an unknown. So then I had to go for some genetic testing to see if I carried that genetic gene, which I didn't. So, but that was all part of, genograms are typically for the unknown. Okay. So for example, if you have a family history of heart attacks, if you have a family history of breast cancer, if you have a family history of alcoholism, you're going to be predisposed to that. We don't have to do genetic testing to figure that out. You already have a family history of that. Right? So family health histories help identify genetic risks. The other big part of family health risks is the environment. Right? What kind of physical environment do your clients live in? Are you working out of an upscale neighborhood or a poverty-stricken neighborhood? What's the social environment? What's the political environment? Is there high crimes in your neighborhood? Pollution? Do you live near a railroad track? Do you live near an airport? Do you live near a waste site? Is it a high stress environment? Is there a high unemployment rate? Is there discrimination that goes on in your community based on race, social status, religion, immigration status? Is there a lack of adequate financial resources, social resources, emotional resources? All lead to higher risk that will eventually lead to a crisis. And then family health risks also takes into account behavioral, what you do to create that. Our current diets are high in sodium, high in saturated fats, sugar, right? That all contributes to high inflammation, contributes to heavy chronic inflammatory conditions. And they list a few here, right? And diet itself, we know, is influenced by environment, socioeconomic things. Okay. Physical activity. It's important that families try and role model healthy eating and exercising behaviors for their kids, right? Kids who grow up seeing these healthy behaviors accept them as normal. So for example, when I get together with my sister, she's a personal trainer. She's been feeding her kids fruits and veggies since they could eat. They get with my kids all eat junk food. I didn't teach them to do that, but so I always feel guilty when I'm around my sister. Her kids are eating fruits and veggies and mine are eating Cheetos. Okay, but kids who grow up seeing healthy behaviors and healthy exercise programs, they learn that that's the norm, right? And the chances of them growing up and engaging in the same behavior is pretty high. And again, behaviors, these are our choices, trying to limit alcohol, avoiding tobacco products, avoiding illegal drugs. Violence and abuse is a strong risk factor for future violence, abuse, substance abuse, mental health disorders, and chronic physical illnesses. Okay. And I need to take out chapter 20. So the next section is health risks across the lifespan. Okay, childhood obesity is huge, huge. Okay. So rates of obesity in children have been rising steadily for a variety of reasons, right? Not just diet and exercise, but environmental exposures, chemicals and pollution. right? And what are the long-term effects of childhood obesity? Cardiovascular, respiratory, renal, menstrual, metabolic, endocrine, right? Bone, joint, psych issues. And then obesity in kids also increases the risk of bullying. And then the next section talks about type 2 diabetes, which you can read about. And then we know that injuries and accidents are common, right? And they're preventable in most cases, right? Falls, fires, drowning, suffocation. And then another big one is exposure to secondhand smoke, right? We've all heard about the increased risk for SIDS. Everybody know what SIDS is? Sudden infant death syndrome.
Yeah.
Okay. We all know that secondhand smoke increases the risk for SIDS when a mother smokes during pregnancy. Okay. Let's go through
And
child.
they have
Go
a
ahead.
new one. They have a new one also. The vaping is
Vape.
having issues with the kids at school.
Okay, so yes. All right, so let me give you the scenario. You're working with a family and it's a smoking environment. Okay, and so obviously the end goal is to have a smoke-free environment, right? So what can you do to provide, what can you do with the parents to work towards a smoke-free environment? What can you do?
Smoking cessation.
Yeah.
Tell the parents, yeah.
Offer them resources to stop smoking, right? Maybe prevent, I mean, they're already living in a smoking environment, so maybe educating them on the risks of secondhand smoke long-term for their kids. There's nothing that makes me more crazy, and this is just a personal, I'm throwing it out there, than seeing adults smoking in cars with little kids in car seats in the back and the windows are up. Makes me nuts. So let me ask this question. What if a parent says to you, you know, I've cut down from smoking 3 packs a day to 1 pack. Is that cool? No, they're still, I mean, it's better, but they're still smoking in the house. What if a parent says, well, I've moved my smoking from inside to outside? Is that better? Better.
It's better, but you still want them to quit.
Right, totally. And my last question is vaping. What if a parent says, don't worry, I've switched to vaping. We're good. Is that good?
No,
No.
Why?
it's still nicotine. It's
Exactly.
still super bad for you.
Exactly. Vaping is the same, it must be the same as smoking cigarettes. All right. So that was an exam question we had with our RN group, which was a parent. If a parent says this, which statement would require further education? And the correct answer was, don't worry, I've switched to vaping and everything's cool. It wasn't worded like that, but it was switching to vaping. And that was the parent that required more education about the same adverse effects with vaping, right? All right, I'm going to have you guys read through these ailments. They match right along with your module. Okay, there's a lot of them, and they're going to be covered in your exam. So have an idea about these are the main ones: asthma, eczema, type 1 diabetes, conjunctivitis. With conjunctivitis, let's say you have a kid with conjunctivitis. Do you want to put heat or cold?
Warm, wet compresses.
Okay. Scabies. Problem, big problem. What's pediculosis?
Head lice.
Lice. ADHD, big, 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 big. Not a problem, but just a large topic. Lots of kids. Right? Iron deficiency anemia. One of my kids had this because he had huge growth spurts and became, it's exactly what the first bullet is. When he was super young, had huge growth spurts and got sick, and we finally figured out that it was iron deficient, iron anemia. Scoliosis. That's something else we screen for in schools. Okay, and then lead exposure we talked about. Oops, sorry. Yeah. So read through these. Okay, these are common childhood ailments. Okay, because in this week we're talking about family development, and especially kids. Okay, would you be able to recognize a kid with asthma? Would you know what to do? You know, what if a kid came to you that said, I really can't participate in gym today because I've got this dry, hacky cough and I just can't participate? Is that a concern? I mean, that's kind of the onset of what? An asthma attack.
An asthma attack.
Right, right. And what if the kid doesn't have an inhaler at school? Is that a problem?
Definitely.
That's a big problem. Okay. We'll go through these a little bit briefly. Eczema. I mean, you can get a gazillion rashes and you just don't know what they are, right? So in the school setting, I don't know if it's contagious. I don't know where it came from. I don't know if it's weeping, and I can tell if it's weeping, but I don't know how long they've had it. Right? So what's the safest thing to do? Go get it checked out. Let's find out what kind of a rash it is. It may be a viral rash, maybe something, a chicken pox.
You have to be careful. Also can be poison, food poisoning.
Well, and it also can be poison ivy. What if they've been hiking in the mountains? Right? What's contagious, what's not, especially in the school setting. These kids are touching each other and touching everything. Okay. So eczema is a big thing you have to be able to identify. And then type 1 diabetes. That's a big deal with kids now. I don't think, when I was growing up in school, I don't even think I remember going to school with a kid that had diabetes, or at least I didn't know about it. Now it's everywhere. In our district, 90,000 kids, we had 900 students with type 1 diabetes. That's a lot. And these first few bullets give you what is type 1 diabetes. Okay, have you guys studied diabetes in your other classes?
It's the one that you're born with. It's when your body doesn't produce enough insulin.
Right, right. You're
So
not
they have to have
necessarily born
insulin
with
around
it.
the clock.
Right. Okay, so type 1 diabetes is insulin dependent. The year before I retired, which was last year, I had kids in preschool that were 3 years old that were on pumps. So pumps are the, well, not new, but emerging treatment of diabetes. Much more manageable in school than insulin injections. Okay.
Those are the things that monitor the child's glucose and like auto injects if they need insulin, right?
Mm-hmm. Yep.
They don't
So
have to keep track of it, or a teacher doesn't have to keep track of it.
No, it's usually done in the, our goal with caring for 900 type 1 diabetes students is to keep them safe at school. So we always had a healthcare plan from their physician of their ranges of diabetes. Typically it's 70 to 150. They could be getting insulin through your kind of old-fashioned way, your syringe and your bottle of insulin injections. They have insulin pens that you dial in, whatever the blood sugar is, dial in 1, 1.5, 2 units, whatever, insulin pen, and then you have your pumps. And so pumps are all over the place now, and there's so many different kinds. But, you know, pumps have their issues as well. Obviously, with the little kids, you got to lock them, make sure they're not punching in boluses. But there's lots of way to care for, there's lots of way to, that we care for type 1 diabetes in the schools. But there's so many more kids with type 1 diabetes. It's amazing. Okay, conjunctivitis, really common in schools, or just common in kids. Okay, viral, bacterial, 2 different kinds. Okay, you always want to make sure that the kid is treated. We send them home. Go home, get your first treatment in with your eye drops, and you're welcome to come back. But you got to start the treatment. It looks like pink eye. Right? And the goop's all coming out. We got to get them treated. Okay, then they can come back to school, because they're always rubbing their eyes and touching everything. And it's very, very contagious. We see a lot of scabies in our homeless population, our homeless kids. Okay. And there's a lot that needs to happen. We actually used to have an infectious disease manual, and it lists all of these infectious diseases. And it was a nice manual by the Colorado Health Department. And it said, what's it caused? What are the signs and symptoms? What's the incubation period? Do you exclude from school, or can you keep them in school? And what's the treatment? So you used to always follow that. It was really good. You just open the book to whatever infectious disease the parent was talking about. And then lice. Lice can be a nightmare, both inside the school and outside the school. Okay. Then ADHD. Pretty common, right? Pretty common now. Okay. And here's some adjustments, accommodations that you can do with the kids in the classroom, putting them in the front of the classroom, clear short directions, rest breaks. Okay. And iron deficiency, anemia, scoliosis. They're usually screened for scoliosis, you know, in their well visits. If they don't have a pediatrician, then we try and get them into these school-based clinics to make sure they get these screenings. We already talked about lead exposure. Okay. So I think we covered most, but I still do want you guys to go back and look at chapter 11 and 12 in your fundamentals book. Okay. Our notes were a summary of those chapters, but I do want you to go back and breeze through those. Okay. And then the other thing you should be working on, you have 2 weeks now. Where is it? Here. Should be working on your Hesi prep assignment. All right. So what did we cover today?
We don't have it. You didn't send it.
I was gonna say it. I didn't see
didn't?
it in the announcements,
No.
and I didn't get an email with it.
Yeah. Yeah, I don't have it either.
Yeah, me
I mean,
neither.
we don't have the form.
Yeah,
Come on.
because last week you
No
said you were
way.
gonna send it to us.
Yes, of course
and
I did. I thought I sent it right after class.
No.
Come on. Oh my goodness. Darn, shame on me. It wasn't in your week 1 announcement either. I believe you guys. All right, I'm gonna send it to you as soon as we're done. How's that? So,
Okay, thank you.
sorry about that. So you guys need to send me an email during the week, after class. You said you'd send this to me. You didn't. You would have had it by Monday night. So what do we cover today? Okay, we covered family health,
Family health.
right? We covered chronic disease. Well, we covered in the notes, but you need to go back and do your readings.
Mhm.
We've done 2 parts today. We've done our concept sheets in the module, and we've done our notes. The 3rd part is all the readings, just to supplement what we're doing. Okay, we talked about patient education, community outreach. Okay, so this is just in sections. It's not all going to be, week 1, week 2. You have to go back and find it. Okay, so
Okay.
go find what we covered. All right, I'll send that as soon as we're done. It's 3:39. I know you guys, this year in your 4th hour of class. So everybody, let's pull up our attestation. Pull up week 2 attestation, please. I'm gonna stop sharing my screen. I'll try. And pretty simple. What's today, the 18th? The 18th, Professor Marvel. Your attestation doesn't have the quiz, right? That's a separate link. Correct?
Yeah.
Hang on, I'm just looking at something. Yeah, that's separate. Okay. Okay, so Eric, just hit submit. Put the date in, submit, and you're done. So if you haven't done the readings, go back and do the readings. And then supplement that with our lecture. I'll send you a copy of the recording. You'll have that in the next couple of hours. Did I send you guys a recording from last week?
Yes.
I thought it was in that email that I attached at the bottom. Okay, I apologize. My bad. Anybody have any questions? Has this been helpful? Have you learned a lot?
Did our is the link for our quiz posted?
Yep, it's right in your module. It's right above the attestation.
I don't see it.
Anybody else see it?
It just has the discussion before the attestation.
No, week 2 doesn't have a quiz.
Yeah, I don't see a quiz.
Right here. Wait. Yeah, it should be in there.
Yeah, I don't see it either. I think maybe you have to change it to like where we can see it too.
Yeah, like publish it.
Yeah, publish. That's what it is.
Oh, maybe it's not published.
Yeah.
Oh, okay, that's easy. I'll do that right after class as well.
And did you say that it was going to be on what we covered in class today, or a little bit of today and last week?
No, it would just be this week.
Okay.
Okay.
Did you guys, was this helpful today? Did you learn a lot?
Yes.
Yes.
Yes, thank you.
Too much information, too little, or a good pace, or what?
Just a question or like a suggestion. Just because we have some like class before this too, if it's possible for us to get a break, like
did get-
even like a 5-minute break.
Oh, you mean,
Yeah.
well, I did give you a break at the beginning of class.
Yeah, that's what I mean. Like it's helpful, so I'm saying thank you.
Oh, yeah. Well, maybe we could think about starting at 10 after.
That's fine, just so we can have like a
Yeah.
little separation. I
I'm
mean, if
fi-
you don't mind.
I'm fine with that, if you guys are fine with that. That way you guys can have a little short break. We'll start at 10. I mean, I'll come on right at 3, but
Mhm.
yeah, we could do that.
Thank you.
Yeah, sure. Whatever works to help you guys out. Okay. I have several things to do. Sending you groups. I have to work on that. Send you the Hesi prep sheet. Publish the quiz. What else? And I still owe you the conversion guide information. Okay, but that Med-Surg, we only have 1 page in the Med-Surg book this week. So you can get your fundamentals book and your other book reading done, all the childhood ailments. Okay?
You said the groups are going to be for the case study that's listed.
In week 4.
Gotcha.
And I believe there's another group project due down the road for infectious disease, I believe. I need to review that. Okay. That's all I have. If anybody would like to stay on after, I'm happy to talk or answer any questions. But I hope you guys have a good rest of the week. And I have my list of what I said I'm going to do. So I need you guys to hold my feet to the fire here. If I'm not sent, I'm usually pretty good about that stuff. So that week 1 was hectic for all of us, including me. So keep me on my toes, right? Please. It was nice to see everybody. You guys have a good week and reach out if you need anything. Okay?
Thank you.
Thank you.
All right. Bye. Have a good day.
Bye.